Welcome to the island of Zanzibar, which is a popular place for vacations. Zanzibar has a unique history of Arab sultans, being the island of spices, and unfortunately, for slavery. Today, many come to explore the history of the Sultan's many palace ruins, the Arab architecture in Stone Town, the museums, and of course, the ocean. Even in the urban center, rural types of simple living are clung to. The Adventist Health System Africa Clinic in Zanzibar serves the community as best it can with a few doctors, nurses, and a lab tech. Pharmaceuticals are readily available locally, and most are very affordable. The Zanzibar Clinic has been operating for 20 years and has a good reputation in the community. Many babies are brought daily for development assessments. Mothers and babies are cared well for here, and that reflects on our Christian presence on this 98% Islamic island. Although the work continues, many building renovations are desperately needed. The clinic needs equipment, housing for doctors, and building repairs, which will cost $90,000. The dark grease on the eyes is to keep away evil spirits. These precious people need a savior. The second building is the women's clinic, which is just across the road. Once it was inappropriate to even discuss planning a family, but now many Muslim women come for counseling on birth control methods, pregnancy checkups, and injections. Now let's get on the ferry and head to Pemba, the sister island of Zanzibar. Right next to the Pemba dock sits a traditional dhow used for fishing. The Pemba Clinic should be the center of the medical mission outreach here, but it has fallen into disrepair in the small city of Chaka Chaka.
I'm Amani, and in fact, through the community, I took the responsibility, and through influencing the community, we dedicated this land for the intention, for the target of launching this. The hospital will include theater, houses, and other things, minor theater. We are very much disappointed. Now there is a leakage, and it is shameful, dishonorable, and disgraceful, and pity. Please, we are drowned. We need SDA to emancipate the community.
We need to raise $160,000 to get things running again here at the Pemba Clinic. The clinic needs a lot of roof repairs, windows, and equipment. We also want to build staff homes right there on the site.
Here we are at the Pemba Adventist Clinic on the island of Pemba, which is part of Zanzibar on the coast of East Africa. We're standing outside a clinic which was built in 2003 but now a shambles. Inside we looked at a laboratory with just things lying around. We looked in a records office with piles of papers which mean nothing now. The doctor's office had an old examination table but lots of dust and dirt and cobwebs in there. There's no doctor here to examine anyway. There are no nurses. So Adventist Health System has come to see what we might be able to do on this remote island where thousands of people could be helped.
We've been given the rare chance to reach out with the right hand of the gospel through healthcare here. What can you do to help? Salaam, which means the city of peace, is now more like the city of stress. Dar is the largest and fastest growing city in Tanzania. It's the center of development, tourism, business, and government. It has many impressive new buildings downtown. The Seventh-day Adventist Church has a radio station here. Although there's a lot of prosperity, there is even more poverty, especially in Temeke. Are we still the light that shines brightly in the darkened world? The health ministry of the Temeke Clinic has been and continues to grow. We have recently completed a new VCT center. The new center counsels and tests people for HIV/AIDS. The cure for the pandemic exists through abstinence or faithfulness. The lab is sufficiently outfitted to test for common local diseases such as malaria, typhoid, HIV/AIDS, and others. From morning to evening, people come to be helped at the Temeke Clinic. Doctors advise their patients about lifestyle and diet, in addition to prescribed medications such as those for malaria. Several new recovery rooms have been built and can be used soon. A large number of mothers and children visit the Temeke Clinic. They check their weight and growth, talk also about good diet, and give vaccinations so as to avoid disease. We want to improve Temeke with a doctor's house and medical equipment, which will cost $70,000. There is no time like the present. We don't want to miss the boat, and you are the key. The people of Dar es Salaam want the peace that passes all understanding, and that can start when they see Jesus in the hands that heal. Arusha is called the Geneva of Africa because of the large international population. Throughout the day, people pray at mosques scattered around the town. AHS Africa has a VCT center downtown that tests and talks with people about HIV/AIDS. This used to be a fully functioning clinic. The dental chair and some equipment still remain, but the roof and ceiling are falling apart and need to be fixed very soon. Room after empty room cry out for purpose, to help, to heal, to care, to just be used. The lab remains untouched. One of the nurses sits down with a young couple to talk about HIV/AIDS. There is still a lot of fear in their eyes, but they listen well and ask questions about how it's transmitted and results of contracting it. They are relieved when both tests come back negative. Now they are committed to remaining clean. The Njiro Health and Dental Clinic, which is on the other side of Arusha, is a good example of what we want to foster in all of the other clinics. Doctors are available and timely with their many patients, and the clinic has a good reputation, equipment, and rooms to care for the people who come. The lab tech is proficient in her work. She tests blood for HIV/AIDS and uses the high-powered microscope to look for the malaria parasites. The urine test covers a wide range of illnesses. The dental wing of the building is always busy. The Njiro Dental Clinic is one of the best in Arusha. This strong position, we hope, will make its operations the supporting arm that will empower the developments in Arusha, Dar es Salaam, Zanzibar, and Pemba once they are properly renovated, equipped, and staffed. Although few of us want to visit the dentist, it's good to have someone you can trust to do a great job. As with the other clinics, The Njiro Clinic has sessions of health evaluation and counseling for mothers and children. The nurse goes over a sheet about the foods which are the foundation of a healthy life. There is a golden opportunity to work and rebuild the health mission here in Tanzania. Now is the time, and this is the hour, to reach those people with healing, health, and hope in Jesus Christ.